this sounds crazy, but we can reverse your type 2 diabetes even if you only can shop at McDonald's. That's not what we recommend. That's not the healthiest possible. We can still reverse your type 2 diabetes.
There's something a little bit contrarian right now about just speaking about nutrition as a potential behavior change.
How do each of these companies measure up, and how effective have they been for patients ultimately?
One challenge in the space where we play is when you touch nutrition, you don't need FDA approval. So the hurdle to making outcomes claims is unfortunately very low.
So who pays for this today? Is it individuals? Is it payers? What's your model?
Sometimes I think because of our outcomes, we should be as famous as Ozempic.
This is Second Opinion. I'm Christina Farr.
I'm Zenooz. And I'm Luba Greenwood.
Welcome to the pod, where each week we navigate what's really going on in healthcare through strikingly candid conversations with the entrepreneurs and investors leading the charge.
Thanks for joining us. Let's dive in.
Hi, everybody. Welcome to the Second Opinion podcast. I'm here this week with Sami Inkinen, who is the CEO of Virta Health. This is a company that has been in the news a lot recently. Really excited to talk to Sami because they are at the confluence of so many interesting trends these days, whether it be in the chronic condition management space, in obesity, in lifestyle medicine, longevity, areas that are really spiking. And Sami's been at this healthcare journey now for over a decade. And he's also really passionate about health and fitness in his own life, which is, I hope, something that we get to chat about today. And my hosts, Zenooz and Luba Greenwood, are here as well. Hey guys, can't wait to kick off a discussion. All right, so I'll ask the first question, Sami. Can you tell us a little bit about your journey into healthcare? Because you haven't been in this industry your entire career. You had a whole prior life. And I'd love to just hear about kind of that moment that you realized that you wanted to be in this space. And what was that aha experience for you?
Yeah, absolutely. Well, first of all, Chrissy, thanks for having me here. Excited to be here. Yeah, I'm a completely accidental healthcare entrepreneur. So very, very briefly, grew up in Finland, physicist by training, started my career in a nuclear power plant. So nothing to do with healthcare. Then I came to America, started a company called Trulia, which went public, then merged with Zillow, so online real estate company. Nothing to do with healthcare. And actually, honestly, at that point, around 2012, 13, I thought I'm kind of done building companies and maybe I'll become like Chrissy, an angel investor. But what happened to me was, I think this is maybe common for healthcare entrepreneurs, that there was a personal experience that led me to founding Virta. And very briefly, my personal thinking always was that trying to solve and address obesity and type 2 diabetes, which we do now at Virta, it's impossible. It's 100% impossible because, let's face it, people eat too much and don't take good care of themselves. And I thought I was the opposite kind of a person because of my endurance sports background and doing lots of triathlons and even winning the world championships in triathlon in my age group. But then I had to eat a lot of humble pie, pun intended, when I discovered that I was pre-diabetic myself and already on my way to type 2 diabetes, despite all these sports accomplishments and exercising 10, 15 hours a week. So it was really that experience.
And how does that happen though, Sami? You've told me this story before and I never get to really ask you, how did you end up with being pre-diabetic? Because you are such a fit guy. Didn't you row to Hawaii or something with your wife? Right after you got married, you're that person. So how does that happen?
Yeah, well, it is true. We rode from California to Hawaii across the Pacific Ocean in a rowboat. And my wife did most of the work. She's awesome. And I'm taking majority of the credit. But so to your question, how does it happen? I'd say the punchline is you cannot outrun wrong diet. You cannot outrun the wrong diet. And of course, I was an N=1, so which doesn't make sense. But there's actually a lot of endurance athletes who are pre-diabetic, and there's some emerging data that it may be something like 30% of people do a lot of running and marathons and triathlons. And of course, more than half of Americans are already obese or pre-diabetic on a population level. But how does that happen? It comes down to you can't outrun a bad diet, and scientists may disagree a little bit, but I would say based on our evidence and experience, it's if you eat too many processed carbohydrates in particular, it doesn't matter how much you exercise. Your blood glucose levels are constantly elevated. which means your body is producing insulin, and you basically slowly but surely start to develop insulin resistance. High blood glucose requires high insulin, and then you eat more of those things that require more insulin. It's kind of like constant high levels of insulin and blood glucose leads into insulin resistance, and there you go.
Sami, I think that's right, but most of us aren't as disciplined as you are. And I've tried to diet, I don't know how many times in my life, and it's impossible. Life is hard, you get busy, right? People have other priorities. So I feel like lifestyle change is as like just as important as and the discipline is important as sort of sticking to a diet. But is there anything beyond nutrition? Is there like coaching or mental health? What's needed? And I guess I'll have a follow-up to that to think about like what makes somebody successful versus not. Because when you're speaking right now, I'm thinking about if I went on this diet, would I be successful? I probably would be for a short amount of time, but I would fail just on diet alone. So what makes somebody successful?
Maybe also then, because we haven't even gotten into what Virta does. So maybe like this is a good way to also explain like a little bit about kind of some of the philosophies that you all have. And then to Ash's point, like, do you see people kind of start out strong and then drop off?
Yeah. Well, yeah, maybe I'll level set. So our mission at Virta is to reverse type 2 diabetes and obesity in 1 billion people. And we achieve that with a combination of nutrition through lifestyle change and very intensive telemedicine and support of our patients. So we deliver everything virtually, and our molecule or our secret sauce is nutrition through lifestyle change. So we don't sell any foods or potions or anything, and we also don't use medications to achieve those outcomes. So that's what we do. And then for listeners who are wondering like how far are you? Obviously, we're very evidence-based and spent 5 years running a prospective clinical trial, and we're able to show in that clinical trial and in the subsequent dozen or so peer-reviewed papers that, yes, indeed, we can systematically reverse type 2 diabetes and deliver sustained weight loss, 13% weight loss at 1 year and 2 years. So it is fundamentally working. But those were clinical trial results. Now we've treated hundreds of thousands of patients, companies, more than 100 million in revenue, way more than 100 million in revenues, top line growing 80% year over year right now. And I only mention these numbers to kind of illustrate that it's not anymore a science project. Does it work? It definitely works. And we've done it at pretty large scale and across nearly 600 different employers and health plans and so forth. And now to answer your specific question, I think what's most exciting and surprising to me is that we've been able to show that it is systematically possible to achieve these results with nutrition with the real Americans who truly need the help. And what do I mean by that is we've worked with tribal nations, Medicaid patients, Medicare Advantage or Medicare patients, blue collar, white collar, like the person that's sort of stereotypical obese person in the middle of America living with type 2 diabetes who's tried 5, 6, 7, 8, 10 diets or programs and have failed at all of them. That is a typical Virta patient. And we've been able to be successful with that type of a persona, if you will, systematically. And that's kind of the most exciting thing that I can maybe share about the outcomes. And so sometimes there's a misconception like, oh, you must be treating a lot of people from Upper West Side, New York and San Francisco and LA. And the answer is that no, we have barely any of those people as Virta patients. But let me pause there. Maybe you want to dive into specific kind of how do we actually do that, or do we see a drop off in the beginning and so forth?
Yeah, I was going to push you on that, Sami, because there are so many reasons why people don't eat really healthy, fresh, plant-based food. And some of it is just there's no grocery stores in the area that sell those things affordably. In some cases, it's not knowing how to cook. I have friends who work in obesity medicine clinics who say a lot of their work is just teaching people, like, how do you cook? How do you make a stir fry? How do you cook broccoli? Like, how do you even cook? And that's not necessarily something that people get taught in the way that they used to. There's so many different factors around this. And you hear a lot from the tech community that you can do this through kind of nudges and apps and all those sorts of things. And that's kind of really been systematically proven to not work. So tell us, like, on a granular level, like somebody's facing all these hardships, these socioeconomic factors, like what makes them successful with your program that has not made them successful in the past?
Yeah, and everything, Chrissy, that you described is the reality on the ground, 100%. So I think a couple of reasons why we have been able to be successful and how we've been able to be successful. Number one is very high degree of individualization to the N equals one person. So I mentioned we work with tribal nations like the Chickasaw Nation. There's a lot of folks working in casinos, and they get their food 2-3 times a day from a casino. So we have to be able to customize to that person. We work in Medicaid plans, say a Medicaid plan in Texas that, I'm not going to mention the name, but a very large one. Folks have access to kind of 7-Eleven type of food. So we have to be able to individualize around that. We actually work with people who may be a stay-home dad or mom who can go and shop groceries. So then we can obviously talk about what do you cook at home. We work with vegetarians, we work with vegans, we work with US Foods company, lots of truck drivers, mostly men. And if you tell them to just eat vegetables, they're going to run to the hills. So they want to have the bacon and a burger. They may stop at the fast food stop with their truck and they go to McDonald's. Well, this sounds crazy, but we can reverse your type 2 diabetes even if you only can shop at McDonald's. That's not what we recommend. That's not the healthiest possible. We can still reverse your type 2 diabetes.
Okay, so I'm in McDonald's. I've done a stop. I'm a truck driver. What do I order then? Like give me the specific, like, before and after.
Yeah, I think in this particular case on Virta, because we have to reduce your carbohydrate intake below your individual tolerance level, we'd probably tell this person to say, yeah, just order your burger that you want, ask it without the bun, wrap with the lettuce. Also, don't add ketchup because that's pure sugar. And then when you go to the soda fountain, take a Diet Coke instead of regular. Now, am I saying that is the most healthy meal for everyone? No, but we can help you to reverse your type 2 diabetes, get you off of insulin with that kind of recommendation. And so that's one part of what we do. It's a super high degree of individualization. Then the second thing is the approach that we use. Yes, it is lifestyle change. And people always ask, wouldn't it be easier if you just kind of ship the food that people eat? Yes, it would be easier. But the universally scalable solution, which is the hardest, is to teach the fisherwoman or the fisherman to fish. That's the universally scalable solution. Because if you ship food, you have your first business trip, you go off the rails. Or if you travel for vacation, you go off the rails. So if you go to your kid's birthday party, you go off the rails. That's the second thing, that we take the hard way, which is through lifestyle change. So it's universally scalable. And then a third one is kind of the bread and butter of what we do and how we deliver. Is one part of it is super intensive support and remote monitoring. And I always use this example that traditional care, you go and you see your doctor maybe once a quarter, every 3 months. And they say, oh, you gain a little weight, your blood sugar is up. Let's increase the dose of your diabetes meds. And by the way, you should eat healthy and exercise and go to the gym. Well, the person comes back 3 months later, again, has gained more weight and blood sugar up. That one interaction per 3 months, we usually have 2 to 3 interactions per day. So we monitor biomarkers from each of our patients very, very intensively, multiple times a day. And then our care team and software guides the person on near real-time basis, like how to adjust, again, even if you're at the McDonald's or whatever that might be the situation. So those are some of the elements that have allowed us to achieve the kind of outcomes. And then we can talk about the kind of what people actually eat, because there's obviously a key part of it is, well, maybe I'll mention here, this is very critical, is better metabolic health cannot be a willpower exercise. And if you have friends on, say, Ozempic, and you ask, why did you lose weight? But by the way, these GLP-1 drugs work to lose weight. The simple answer is, I'm just not hungry. And so one key pillar of the Virta approach is that our patients are not unnecessarily hungry. In fact, we counsel them to eat to satiety. And I think the Weight Watchers CEO publicly said a couple of months ago, yeah, sorry, we've been asking you to count these points for 30 years, but we have to admit it doesn't work. And she was right. Willpower exercise does not work, because willpower runs out the window, usually after the wedding photo, if not sooner.
Hey everyone, we'll get right back to the conversation after a word from our sponsors.
This show is sponsored by Midi Health. There are certain things that come with age: wisdom, experience, and knowledge, to name just a few. But if you're a woman over 40, it can also bring some less desirable things: hot flashes, insomnia, brain fog, moodiness, and weight gain, all symptoms of menopause and perimenopause. Yes, hormonal transition is a fact of life, but that doesn't mean you should have to accept its symptoms as just another part of aging. The experts at Midi Health understand what you're going through and know how to help. Midi Health is the only virtual care clinic for women navigating midlife hormonal transition. They support you with safe, effective, FDA-approved medications, as well as supplements, lifestyle coaching, and preventative health guidance. What's more, all their services are covered by insurance, and they're conveniently accessible through telehealth visits, 24/7 messaging. If you're over 40, use all that wisdom you've gained over the years and visit Midi Health. You deserve to feel great. Book your virtual visit today at joinmidi.com. That's joinmidi.com.
So let me ask you this. Probably it's 2025. So around 10 years ago now, about 2015 is when a number of companies started popping up. Even back when I was at Google Life Sciences, which became later Verily, we had a very similar product that we were working on where you have a tightly monitored patient with biomarkers, just as you mentioned. And a lot of that came from the research that you also highlighted, that you can reverse not all of type 2 diabetes, but there's a high percentage of people for whom you can make a big difference. So we had all of that. And there are a lot of companies over the last 10 years, I would say, that do the same. And they do it in very different ways. But overall, it's the same point, which is eat healthy and we'll track you. Lots of people track in different ways. But we still have predominantly people that are diabetic and obese, and these solutions still don't work as well as GLP-1s. And so I guess my general question is, number one, how does a patient or person differentiate between these offerings? What is really the difference? And why haven't any of them been as accepted or have not worked as effectively as medication?
Well, I will push back and say, and this may sound obviously I'm biased, but Virta does work. And it is very, very, very hard to deliver what we deliver, but we have made it work. So I don't want to admit that all diets have failed. I will admit that 99.9% of them have failed. And maybe this is cause I'm the founder and CEO. So like, what's the credibility of me saying our thing works besides the numbers that I already shared?
I just want to be careful. It's not diet, right? I'm not talking about diet. I'm talking about companies that do exactly that, which is they have a regimen that fits with your lifestyle, that works, and you track biomarkers and you remind people, hey, so very similar to what you're doing. So what is the differentiation there?
Why the others don't work and why Virta works? Is that the question?
Well, I think others also work. I think a number of these companies work. I guess my question is, if you're a patient or you're an individual and you're trying to lose weight and you're trying to pick which one works, what should I go with? Should I go for Ozempic? Should I do this? Should I go with your company? Should I go with others? What is the difference, and how do each of these companies measure up, and how effective have they been for patients ultimately?
Well, I will mention this is a third party. I think listeners may know Peterson Health Technology Institute, PHTI, is a third party that looked at all the digital diabetes companies last year. I think it was last year. And their conclusion was none of them work. Like none of them work except one. And that was Virta. So I will mention that there are, you can go to Apple App Store, Google Play, and there's 1,000 diet apps, and I would say none of them work. And so one challenge in the space where we play, as Virta as well, is when you touch nutrition, you don't need FDA approval. So the hurdle for making any kind of a claim, like, oh, I have a coach and I have an app and I have this, the hurdle to making outcomes claims is unfortunately very low because you don't need FDA approval, unlike for pharmaceuticals. So I think the premise of the question is it's a noisy space, and it is incredibly hard for individuals to know what's snake oil and complete, let's be honest, bullshit, and what's actually working. And it is challenging. I would say what has been helpful for Virta, now we are kind of a early overnight success, 11 years in the making. So it has taken a long time. We try to be very evidence-based. Again, 5-year prospective clinical trial, dozen peer-reviewed papers. This PHTI analysis is an example of, given the evidence we had, they were able to look at it. And then I think in a channel where we work, which is the employers and health plans and PBMs and some government entities, obviously there's way more scrutiny than just downloading an app from the App Store. So that's another one that's been helpful for us, that when a large employer like United Airlines or UPS, all our clients, or big health plan chooses to work with you, you obviously have gone over many hurdles to get there. But I completely accept the premise that unfortunately you just go to Instagram or you walk to GNC and it's like, it's mostly bullshit. Like, how do you make sense of what actually works here? And it is very, very, very challenging for consumers. And that's honestly been a struggle for us. And Virta is still not a household name. And sometimes I think because of our outcomes, we should be as famous as Ozempic, but we are 100. We are 100.
Yeah, hopefully we'll make you guys a household name here, because it's a very good point. There's a lot of things that don't work and are BS, and you guys have a lot of clinical based evidence. So yeah, fantastic.
But what do you think though, Sami, about like, your space? It's just hard. Like what you're doing is really hard. And even we did have Caroline Pearson from PHTI on this podcast. We actually talked about a little bit about your space, and compared to some of the other categories they've looked at, like MSK, it's just you're in a uniquely difficult space, which I think we really just touched on then. So how do you feel about just like like you're a person, you're an individual that's really struggled and you really want to lose weight. You would love to not be pre-diabetic anymore. Like, should we just have kind of like an option A, option B, option C, option D? Maybe option A is a mix of Virta and Ozempic. Maybe option B is Ozempic for 6 months, followed by a program like yours. Maybe there's an option C that's medication only. I mean, I could sort of go down the list, but you get where I'm coming from. That maybe like, is the future just like a super personalized intervention that is designed for each individual? Because some people there's just different reasons. Like a friend of mine just lost 50 pounds, and a lot of the issue for her was actually mental health. Like she had food noise, so she couldn't stop thinking about food all day long. Food. It was just part of the running kind of treadmill or dialogue in her own mind. And Ozempic helped because it shut it off for the first time. So that was why she was able to then kind of move into a lifestyle-based program effectively. So curious what you think about that.
Yeah. So again, I mentioned we focus on reversing type 2 diabetes and obesity, but let's just focus on the obesity side of things, because type 2 diabetes is a little bit more, I guess, mature space, and there's clinical guidelines. Like first you try this diet and exercise, and if it doesn't work, then your medications. And now obviously with Virta, we've shown that even if you had type 2 diabetes for 15 years and you're on insulin, we can actually reverse that in 6 months. But let's leave that aside. So in obesity space, I actually think we are in a kind of a flux, and it seems very complex, but I think it's going to be the end equilibrium pretty simple. And here's what it is. I think we need a bag of tricks to address obesity at scale. And if we leave the sort of policy and awareness and nutrition policy aside, the bag of tricks is actually very simple. It's 2 things mainly. Maybe third one, but it's really 2 things. It's evidence-based pharmaceuticals and nutrition, lifestyle change. The third one maybe, but I think thanks to the pharmaceuticals, it's going to go increasingly away. That's bariatric surgery. Now, it is evidence-based. By the way, we have many patients come to Virta who've had some sort of bariatric surgery, gastric bypass, and then 2 years later, they gain the weight back and they come to. So, but I leave that aside. So I think the bag of tricks, the conversation, nutrition versus drugs versus nutrition, either or, it's kind of like political divide. It's ridiculous. The smart solution is in the middle. So I think the bag of tricks will continue to include drugs and nutrition. However, the approach, and hopefully this doesn't sound too biased coming from me, is nutrition has to be always the first line of defense. If for some reason it doesn't work, then we can use evidence-based pharmaceutical. Mostly it's GLP-1s these days. And then with the drugs, obviously you need an off-ramp. I think in very, very rare occasions, someone's just going to be on GLP-1s for the rest of their lives, because the drugs totally change how much you eat, but it doesn't change what you eat. And we don't even know all the side effects besides lean body mass loss and so forth if you own these drugs, however. But I think that's, Chrissy, kind of simplistic view that nutrition and drugs will be used and probably will be the bag of tricks. And hopefully nutrition will always be in the first line of defense. And then where it's not sufficient, these GLP-1 drugs are wonderful. Honestly, they're way better than any drugs before treating obesity.
Sami, you mentioned GNC, so I just want to ask here, where does non-dietary intervention, I've been hearing about microbiome therapies or precision supplements, I guess, where do those fit into this bag of tricks?
I think the claims are way too many steps ahead of evidence. And obviously everyone wants to sell their magic potion and magic pill and this and that. But I think just we don't have enough evidence. And obviously we can talk about gut microbiome, which is an exciting area of research. And everybody knows the statistic that there's more bacterial cells in our body than human cells. But I don't think we as a science collectively. But when the evidence comes, then maybe there's room. But most people, if you use nutrition appropriately and that helps, there's very little need for extra supplementation of any kind, quite frankly. But I will follow the evidence. If there's something that's credible, then it may be helpful.
All of this is great, Sami, but I think what I'm hearing is there's a lot of personalization that's required. And that means, in my mind, it's people. Like you need a lot of people, you need to be looking at a lot of evidence and data and research and one-on-one interventions. Is that accurate in your mind on how you're thinking about Virta, or are you using a lot of technology in the background? What does that do to like a business as you scale and grow?
Yeah, no, as a business, we have a wonderful business. So like I said, we are way north of 100 million revenue, top line growing 80%. But I would say most importantly, we are going to become profitable second half of this year, which very few health tech companies with less than 300 million in revenue have been able to do that. And after we become profitable, we'll be generating lots of profits. So we have a very, very attractive model already. We have good gross margins. We are not 90% gross margin business. We actually don't even want to be. Like, we're not trying to pretend we are pure software. So it is working very well. In terms of people, we use people. We are a provider. So we employ medical doctors who form oftentimes 3-year relationship. These are all full-time W2 employees, 3-year relationship with our patients. We also employ coaches who are also full-time employees. So these are not like network kind of outsourced, because they form a very tight relationship with our patients. And we empower them with software and technology and AI. And so I always say that we want to give superpowers to our coaches and providers so that they can do the best that humans do, which is empathy and dealing with these sort of kind of life curveballs, whether that's death in a family, you lose your job, or those kind of stressors. Because if you can't handle those, and that's where you need human, not AI, you can't make the nutritional lifestyle changes. And so, yes, we use humans. Yes, we empower them with technology and AI, but it is already working. And as we think of scaling from here, we are a tech company at the core. So we don't want to scale linearly by hiring more people, but we will be hiring more people as we scale our number of patients. But we are not trying to replace humans, because the humans are actually, it's necessary for the outcomes we deliver. Our patients love it. And I actually think it's almost like a competitive advantage for us that you come to Virta Care. This is not just an app, and we're not an online drug trader. Like, it's just an app, click here, and we send you drugs. There's a real human, a doctor, who forms like a 3-year relationship with you. There's a real coach who cares about you. That makes a huge difference. I can't even quantify how big of a difference it makes, but it definitely makes difference in retention, in outcomes, all the things that our clients want and our patients want. So I think the model that we built, it is working, and it is a combination of humans and technology.
So who pays for this today? Is it individuals? Is it payers? What's your model?
Nearly 100% of our patients get free access to Virta. And the reason is their health plan or their employer pays for Virta coverage, and they knowingly pay. This is not like we kind of slipped into their network and then do fee for service and nobody even knows that they're paying. No, we have direct relationships with about 550 different clients. And they pay because we save about $600 a month and we charge way less than half of that. So the savings when reversing type 2 diabetes or even delivering weight loss vis-a-vis GLP-1s, there's a massive amount of quantifiable savings happening very quickly. So employers and health plans are very, very happy to pay for the treatment. So that's the model, that individuals who struggle with type 2 diabetes or obesity, they come to Virta for free.
So what's next from here for you? I mean, I guess you've been around for 10 years, if I remember correctly. So congratulations on that. What are next steps? Is it to go beyond the Midwest, to scale into different regions of the world? Like what's coming?
Yeah, well, first I should say I gave these sort of Midwest examples. So we treat patients in all 50 states, treated hundreds of thousands of patients. So we are already nationwide. For us, it's really, number one, the problem of solving type 2 diabetes and obesity in America first. You just look at Eli Lilly's market cap, nearly $1 trillion. It's a huge problem. And sadly, more than 150 million American adults struggle with type 2 diabetes or obesity. And we haven't, it's exciting, but also embarrassing to some extent. We haven't even scratched the surface. Like 150 million Americans are struggling with either type 2 diabetes and obesity. So number one thing for us now, it's working. We're about to be profitable this year. It's just scale. And obviously scaling care and outcomes and ensuring patients say it's never easy. It's like, it's difficult. And so that's a huge number one focus for us. And then secondly, we do have a pipeline of other conditions that we want to go to. And actually, I can't even mention which condition, but over the next 100 days, we are going to release some data on delivering outcomes in a metabolic health condition that is very surprising that you can nutritionally improve it. But we'll be releasing some of those outcomes. But I'd say primary focus for us is to just keep scaling type 2 diabetes and obesity. And then as a company, I think what will help on this mission is to become an independent public company. And that's sort of the next capital market step for us.
Obviously, we have a new administration. Where do you see things moving and shifting, and what does that mean for you?
Yeah, well, in terms of market first and new administration, I should say that I love the slogan that make America healthy again, because Virta has actually been making America healthy again since 2015. And it's not just as a joke. Like, we've truly been reversing type 2 diabetes and obesity with nutrition, which is exactly what the MAHA movement is about. So I'm excited about that. In terms of markets, honestly, and Virta going eventually public, I took my previous company with our team and with my co-founder public as well. So I've gone through that before as an entrepreneur. That's just a stepping stone. And I think there's a huge focus of what's the valuation multiple and what's this or that. Well, guess what? There's some things that never go out of fashion, and that's profits, revenue growth, and sustainable revenue growth. So if you have a good business, going public and becoming a public company is just a great stepping stone. So in my opinion, in sort of financial press even, there's sort of too much focus on like what's today's valuation multiple and what's the valuation today. To me, that's just the point in time. Like, if you have a great business, it doesn't really matter that much. And like, I think Warren Buffett has said, the public markets, they are a voting machine. Short term, that's kind of like the valuation multiple. Long term, it's a weighing machine. So if you have billions in revenue, you have millions of happy customers, you have a very valuable business. So I'm less focused on what's happening right now, but I will mention that what's bad for kind of capital markets, equity markets in particular, is uncertainty. Well, unfortunately, like, we are recording this early March, lots of uncertainty. That is bad. That's bad for business in general. It's bad for capital markets. And then secondly, high interest rates, high inflation, that's bad for capital markets and equities. That's also, we're still living in a time of high interest rates. So those certainly aren't tailwinds for new IPOs, I would say. But as an operator, I'm just focused on scaling a great business, and the sort of the short-term valuation multiple thing to me is like, it doesn't really even matter.
Sami, is there anything that you want to talk about that we didn't cover?
Obviously, there's no shortage anymore for the branded drugs, so the compounding stopped. And what does it mean to companies?
Tell us what that means. I think this is clearly impacting others who've been compounded drugs have been really great for some companies, and they've been growing like gangbusters. And now with the recent announcement, right, like things have come to a halt.
Yeah. So for us at Virta, we deliver nutrition first, weight loss, and type 2 diabetes reversal. So whatever is happening with the drug prices, so compounding or shortage doesn't really affect us directly. We're always nutrition first, and we also work with employers and health plans. So we're not a direct to consumer, what you might call an online pill mill or drug trade online. But for the companies whose business is basically selling drugs online, the drug trade, the only way to make the business work is that you can mark up the drugs. And generally people buy vanity drugs. So this is why historically the business has been made in this online drug trade in ED pills, hair loss pills, Adderall, and then the weight loss drugs came. But if you can't mark up the drugs, you just cannot make the economics work. It's like the drug dealer, corner of the street, the way they make money is they double or 10x for what the wholesaler paid for them. So with GLP-1s, these are branded drugs like Zepbound or Wegovy. You could not make money selling them as an online e-commerce drug company. However, the compounding was like a backdoor or side door where you could get super cheap, quote unquote, generics, and then you could mark it up and you make money. So that's, of course, what a ton of companies, not Virta, jumped in and said, hey, we can be printing money, like the ED pills, like the hair loss pills. So that was the model.
Sami, quick question. So have you seen the recent news for Novo, how they're now having their own pharmacy and again, undercutting their own price? So they'll be selling at a lower price. What are your thoughts on that?
Yeah, I think both. Obviously, Eli Lilly and Novo Nordisk have the direct channel as well. But for both those companies to get to massive scale, it has to be through the primary care doctors and PBMs. So I do think that is the number one channel, and I don't see them cannibalizing that. For them to get, again, in the US, at least in a massive scale, it has to go through the insurance coverage, then primary care doctor, or even a company like Virta in some occasions prescribes and manages the drug. I do think that is the primary channel. I think these direct channels are potentially a complementary revenue driver for the pharma companies. And to some extent, I think, this is my guess, is a defensive move as well to kind of block the compounding business, to say, hey, there is a direct option available and it's not $1,000, it's only $500. So, but I see it as a complementary channel for these pharma companies, but I don't see that the bread and butter, which is insurance coverage through employers or health plans, PBMs, I think that's 100% the main channel.
Well, we will see business evolving in this space.
Thank you. This is fantastic. Thank you so much.
Yeah, it was great.
This was an amazing dialogue. Every time we speak, I feel like I learn something. And there's something a little bit contrarian right now about just speaking about nutrition as a potential behavior change, even though I think we do know on some level that it's really, really important. It's more loaded perhaps than it should be, but it's been nice to see companies like yours really continue to just shout from the rooftops about the benefits of eating well. And it's something we need to keep talking about. Would love to have you back on the podcast.
Love to have you back. Nice to see you. Good luck.
Yeah, thank you so much. Yeah.
And thanks to my co-hosts, Ash and Luba.
Thanks for tuning in to Second Opinion. Share it with colleagues and friends and message us to let us know what topics you want to discuss on the podcast. If you want to support the show, the best ways are to leave a review wherever you're listening and make sure you are subscribed. And check out Christina's Second Opinion newsletter on Beehive. A link to subscribe is in the episode description. Second Opinion is part of Turpentine, the podcast network behind Turpentine VC, Age of Miracles, and more shows for experts by experts in tech.
Hey everyone, Eric here. At Turpentine, we're building the first media outlet for tech people by tech people. We're the network behind the show you're listening to right now. We have a slate of hit shows across a range of topics and industries, from our AI and investing cluster of podcasts to shows that drive the conversation in tech with the most interesting thinkers, founders, investors, and influencers, like Econ 102 with Noah Smith. We're launching new shows every week, and we're looking for industry-leading sponsors. If you think that might be you and your company, email me at ericaturpentine.co. That's ERIK at turpentine.co, and let's partner together.